Dr. Atwell, we talk about diabetes all the time on Live It Fit Now, especially how it relates to insulin resistance and storing more body fat. Talk to me for a second, though, regarding diabetes and overall health.
Diabetes has a profound effect on the eyes. It's one of the leading causes of non-infectious blindness in America, and it's becoming an ever-increasing problem that we deal with in our clinic. Oftentimes, and every ophthalmologist will tell you, it's something that they've been able to diagnose by seeing a patient who just happens to come in off the street and wants to improve their vision. Diabetes affects the eye on multiple levels. Really, the most profound effect, I think, is on the retina, on the back part of the eye, where it affects the small blood vessels and causes leaking of the blood vessels and scarring of the very sensitive tissues in the back of the eye. It also affects the lens in the eye and causes cataracts, early onset cataracts. It can affect the dryness level of the eye. It can really affects the body in so many ways, and the eye is very similar. It affects the eye in just about every structure of the eye.
If somebody has high blood sugar or is slightly diabetic and they come in for an eye exam, how do you treat that differently, and what will you be looking for?
Well, it depends. There's so many different treatment modalities that we offer with laser of the actual retina itself, cataract surgery, injections of medications into the eye to help affect the swelling of different parts of the eye. It really depends on what level they present to us with. Sometimes there's very profound issues with the eye that we have to treat, and sometimes it's very mild. Sometimes just recommendations in diet can have huge effects on the eye, and so next time we see the patient, it can be totally reversed.
So the prognosis is really good if they do the right things and get the treatment?
Coming in early and not being scared to get the examination is the most important thing you can do.
I was just about to say, what would you recommend somebody does to make sure, if they do have a problem, that you're catching it early?
Just call us, make an appointment. Don't be afraid to make the appointment. You'll thank yourself later for it.
Doctor, once again, I appreciate it. Going to be with us again next week?
Absolutely.
I'm going to hold you to it.
Okay.
Don't go away. We'll be right back.